name's Mark. I'm a trainee clinical scientist for the NHS, and I want to discuss today NHS privatisation. Now, when looking into the scale of NHS privatisation, the Health and Social Care Act introduced by David Cameron was a whole new pathway for private companies to buy the rights to NHS services. In Portsmouth specifically, where I work, the PET scanner is owned by a private provider called Alliance Medical Limited. Through clinical commissioning groups, the Health and Social Care Act 2012 allowed the introduction of the rights to buy contracts from private providers. Now, these work by allowing for-profit companies to give the government a short-term cash boost in exchange for a larger amount of money over a longer period of time to run NHS services. The problem is with this model of operation of providing healthcare is that these companies, they exist to make profit. So the sources of their profit therefore come from either not spending money on running the NHS services properly, not hiring enough staff, although these staff may be paid more, and passing the cost of this on to customers. The big worry is that the final option may happen at any time whatsoever. It's unlikely the whole NHS would sell all their contracts to providers at once, because obviously no government wants to alert the population that it's happening. But it is a total of £9.2 billion worth of public health contracts and 1.3 billion of social care contracts were sold to private providers in 2018 to 2019. That's 15 billion since 2015. And this came despite the fact that Healthcare Secretary Matt Hancock has promised that NHS privatisation is a myth. They are outright lying about it. These companies providing services can also go bankrupt. So that leaves the taxpayer to foot the bill to pay off their debts that they can't pay themselves, so that the workers don't lose their jobs. And in the case of where I work at Queen Alexandra Hospital in Portsmouth, when Carillion, which is the UK's second biggest building company at the time, went bankrupt, it cost the taxpayer 140 million to pay off the entire company's debts. And this also left projects such as the completion of Royal Liverpool University Hospital and Midland Metropolitan Hospital. These projects were completely abandoned. They're also found not to be built to the required health and safety standards that the buildings need to be built to. Such as asbestos was found in the walls. So the government continues to state that the NHS is not for sale. However, Boris Johnson also increasingly states his desire for a trade deal with the US after Brexit. The president of the US specifically states that, firstly, the NHS or anything else must be on the table in a post-Brexit trade deal. Who cares if he's changed his mind about that? The President of the United States has also stated that he does not support ideas for universal healthcare in his own country. You don't have to go far to find information about that. Boris Johnson himself has specifically stated in Parliament in 2006 that the NHS is a monolith killing off market competition and should be broken down into non-profit organisations and private providers. So who's to trust him when he says that the NHS isn't for sale? Boris Johnson hasn't even given a reason as to why a 451-page document detailing that apparently the NHS very much is up for sale. So I can understand the fact that some of you think Labour's ambitious manifesto isn't going to be able to be pulled off, but that does include removing private company involvement from the NHS, which realistically would save us money and provide a better standard of healthcare. So you may not think Corbyn is the leader of a country, but in Parliament he has always voted against private sector involvement in the NHS, unlike the current government, which has been proven already. And feel free to double check this yourself on a website known as theyworkforyou.co.uk. It's an independent website which provides a complete entire list of everything that every single MP has voted on who's currently sitting in Parliament. And you can use that website through some other videos as well. So for people from working backgrounds like me that can't afford to pay for healthcare and never will be able to afford to pay for healthcare, the NHS is the most important issue. It was the best healthcare service between 1996 and 2004, according to the World Health Organization. If our country has gotten richer and there was less private sector involvement then than compared to now, then we can definitely afford it now. We can definitely afford world-class healthcare now, and we should be able to have world-class healthcare now.